In children and adolescents, the gold standard for treatment in OCD is CBT, particularly exposure response prevention treatment. If they have moderate to severe OCD, then adding a selective serotonin reuptake inhibitor is considered the gold standard with ERP, so that combination treatment. So SSRIs, people know them mostly as antidepressants, which I think people are often confused by. They are what we definitely consider to be first line for OCD treatment in children, adolescents, adults, it doesn't matter the age. So we have other medications that we can use as well, but most people in the outpatient world can respond to ERP with an SSRI. If they have other symptoms like tics, maybe some of that externalizing behavior where they're having like meltdowns because their symptoms are more severe, we may use some other kind of medications. We may use things to help bring down that aggression. So there's medications like guanfacine or atypical antipsychotics that sometimes we end up using, particularly if they have tics, because those can be specifically used for tics. And we think a lot about comorbidity when it comes to OCD because that might get in the way of their treatment with ERP. So kids who have ADHD, we definitely want to make sure we're appropriately treating that so that they can engage in treatment, or if they have really significant depression because they've lost, function. I always say OCD shrinks their world, starts taking things away from them that they really enjoy. And so they may be depressed. And if you're really depressed, you often don't feel really motivated to do therapeutic work that's hard. And so we may want to treat their depression. So the core symptoms of OCD, we're going to use an SSRI for, but we're definitely thinking about all those other things too to make sure they're not interfering with their treatment of OCD. When it comes to treating children and adolescents with OCD, many of them don't need a psychiatrist. They can, if they have good exposure response prevention treatment available in their community, they can go see a therapist who's trained in that and they can get better. However, there are some kids whose symptoms are severe enough, so it would be moderate to severe OCD that you would start to consider medication. But even those kids don't have to have medication. It's really typically their comorbidities that sometimes get in the way, but many kids can go without medication and get exposure response prevention treatment and have their OCD treated well.